Hello friends, welcome to Dr. Eyes. I am Dr. Neelkant Kote from Lifespan Diabetes Clinic, Bangalore. Today's topic for discussion is the relationship between diabetes and cardiovascular problems, in particular myocardial infarction or heart attack. Diabetes mellitus, as you know, is a metabolic disorder characterized by hyperglycemia, increased blood sugar values, either due to the deficiency of insulin in the body or due to increased insulin resistance at cellular level. The classical symptoms of diabetes mellitus are polyphagia, polydipsia, and polyuria. Polyphagia means feeling more hungry, polydipsia means feeling more thirsty, and polyuria means frequent urination irrespective of the period of the day. Diabetes mellitus, when not under control, can lead to many complications in the body, and myocardial infarction is one of the major complications in type 2 diabetes mellitus. Myocardial infarction, in general terms, also known as the heart attack, is a cardiovascular emergency characterized by symptoms like severe chest pain, radiations of pain, sweating, and palpitation. This myocardial infarction, when not treated on emergency basis, might lead to severe complications and death. Cardiovascular problems, especially myocardial infarction, is more frequent in type 2 diabetes mellitus, and it is scientifically proved that patients who are under diabetes treatment and not under control, in other words, patients who are with a history of uncontrolled diabetes mellitus have higher chances of developing myocardial infarction than the patients without diabetes mellitus. And myocardial infarction in diabetes is called as the silent myocardial infarction, because the classical signs and symptoms of myocardial infarction, which usually exist in other conditions, they do not appear. They are not that pronounced in type 2 diabetes mellitus patients. Hence, the patients with myocardial infarction, especially with diabetes mellitus, do not feel the pain or the sweating or the classical heavy pain in type 2 diabetes mellitus. Hence, it is called as silent myocardial infarction. You might have come across many such cases in your life that patient was apparently normal. He took his regular medication, he went to bed, and then the next day morning he's no more. That could be probably because of the silent myocardial infarction that he suffered overnight, and he could not feel the pain because of the nerve damage that occurred in diabetes patients, classically known as diabetic neuropathy. That is why American Diabetes Association strongly recommends that every diabetic patient, irrespective of their sugar status, should go through a cardiac evaluation once in a year mandatorily, so that these kind of complications can be easily avoided, prevented, and maintained well. So that is the relationship between diabetes and cardiovascular problems, especially the myocardial infarction in particular. Thank you for listening. For more such further updates, please log on to Dr. Eyes, and I'll see you in the next video with a new update.